Why don't I want VATS surgery for my diaphragmatic endometriosis? Good question. Firstly, I'm pretty fortunate in that I don't have severe upper abdominal chest symptoms. Over the past year, I've had symptoms that have come and gone. Those have included rib pain, difficulty breathing, upper abdominal swelling, and cyclical nosebleeds. Very recently, over the past 3 to 4 periods, I've started to experience right shoulder tip pain. It comes on the first day of my period and typically lulls around on and off for about 3 days. So symptom-wise, I don't feel symptomatically desperate for surgical treatment. That aside, I don't think any person, any woman should be made to wait until she's absolutely desperate and emergency case to receive surgical treatment. That being said, VATS, Vudeo Assisted Thoracic Surgery, is a huge deal. A surgeon is going in through your ribs into your chest cavity where you have very vital organs, your heart, your lungs, the top side of your diaphragm. And for that to be done in general, to have your ribs touched, you've probably heard that tattooing on the ribs is unbearably painful. To have surgery done, first and foremost, the pain of such surgery, the recovery. There are so many nerves within the chest cavity that some women continue to experience pain, sometimes worse pain, months, if not years post-surgery. It's very high risk and therefore should only be performed when necessary, when the likelihood of improving a patient's life outweigh the risks to the patient. Which brings me on to my next point. The number of thoracic endometriosis specialists within the UK that I'm aware of through my own research, so it's not definitive, but generally speaking, it seems to be the general consensus. There are two. There are 2 thoracic endometriosis specialists out there. True thoracic specialists that know endometriosis and know how to treat it too. So as someone who is very analytical, the way my mind works is, what is the cost versus reward? If I'm told that my endometriosis will be more or less standard procedure and easy to remove, and that my quality of life, my symptoms, my outcome will be significantly improved, then I may well decide that it's worth the risk. I don't actually know all of the risks associated with thoracic endometriosis. I haven't looked into them in the way that I've looked into pelvic laparoscopy surgery complications, risks and complications. So I don't even have all of that information on hand. And most women with endometriosis have been led to believe that surgery is the answer. Surgery will guarantee symptom relief to an extent, if not completely. Even with the best expert hands, that is never a guarantee. My reason for going into surgery, I have a growing endometrioma ovarian cyst, and research has found that if you are a woman with endometriosis and you're prone to getting endometriomas, you're at higher risk for ovarian cancer. That's one. Secondly, I've had an incredible amount of disease growing within my pelvic cavity for God knows how long. My diagnosis was back 9 years ago. I was diagnosed by diagnostic laparoscopy. Before that, I had years of symptoms that I just put down to bad periods, and we all know why that is. So I have an insane amount of disease in my pelvic area that is causing my ovaries to attach to my uterus, to attach to my bowel, to attach to my uterosacral ligaments, to attach to my cervix. There's lesions. All of that is bad enough, but it also means inflammation. And for me, I want the disease out. I want the inflammation out so that my body can slowly normalize and recover. So I'm not going into the surgery thinking it's going to stop my bowel symptoms. I'm not going into the surgery thinking I'm going to have 0 pain, 0 digestive issues. No. For me, I'm going into this surgery having done my research, ensuring that I'm in the best possible expert hands to have as minimally invasive a surgery as possible to rid me of this disease that has been a part of my life for decades, to rid me of it as much as possible. So now flicking back to diaphragmatic endometriosis, I don't know the extent of it. MRI is not very good at picking up on it. It's picked up on something that they suspect to be diaphragmatic endometriosis, but until they're inside and taking a look up at my diaphragm, I'm not going to know the true extent of it. I've had upper abdominal symptoms for years whilst I was on the pill years ago. I've had them for years. I've had odd chest symptoms, racing heart, times where I felt like POTS, on and off for years. Again, I was on the pill, so I could never attribute it to a period. I wasn't having my periods. So I don't know the extent of it, but I do know VATS is very invasive. VATS is a very big surgery. VATS is more higher risk and has more risk of complications than laparoscopy. VATS is a very hard recovery. I'm talking women being in pain for weeks, needing strong painkillers, not being able to work. So all of these have to be taken into account. And what I'm seeing over and over again is misinformation or a lack of information. Women are not as informed as they need to be when it comes to surgery. So I also want to use this as my message to you to say, please proceed with caution when it comes to surgery, especially VATS.